Oh, hello, folks. Hope you're well. Folks, this evening I got some information to pass on to you. This is not a sales pitch whatsoever. Hopefully, I'll break the monotony of talking conspiracy theories and well, not theories, are they? Talking about conspiracies, but I want to bring something into your life that maybe you haven't really considered. It is true in the UK, particularly anyway, that we're a nation of dog lovers and pet lovers, I would have said. I mean, we are obsessed with our pets, and quite rightly so. Life would be bloody miserable without my dogs in my life, that's for sure. But historically, I've been into falconry. I've had a tortoise or two when I was younger. Bearded dragons. Heavily into bearded dragons at one stage. I was very obsessed with them for a while. Yes, and I used to breed canaries, Yorkshire canaries. They're quite a long, beautiful canary. And Goldian finches, these little beautiful little birds. So I've been animal obsessed. I should have been a vet, quite frankly. But that would have taken the pleasure out of it, I think. I got a lot of friends who are vets. And well, they have pets as well, but I think it's a well, if you're playing with animals all day in that respect, or repairing them, doing surgery on them all day long, you tend to see them in another light, I suppose. But it would be, if I was a vet and I operated on my dog, it would be a bit dodgy. You generally don't want doctors to operate on members of their family. And my pets, I should say our pets, our dogs, are part of the family, and we love them. You do. It breaks your heart, doesn't it? I'm sure if you've had pets and they've died, you've been heartbroken. Even when they're ill, we still fuss. And yes, we go to the vets. We spend a fortune on vets. Yes, I think I'll pay for my local vet's house. But hey, they're worth every penny, aren't they? Look at the love they give us. Unconditional love animals give us. And we should take care of them. And nothing distresses me more than people who don't take their pets to the vet when they're ill. They try to do, well, it's only a dog. What do you mean it's only a dog? These people infuriate me. I treat animals with lasers, and I treat human beings with lasers. Okay, and there's a real difference in my eyes because I'm dealing with biological tissue, and I get a great deal of pleasure out of doing laser treatment. Everybody says laser treatment burns and no, I'm not talking that laser cutting level. Although these lasers will burn you, I'm talking about therapy, drug-free, therapy. No lotions, no drugs, no side effects, no expensive vet fees, yada, yada, yada. Said it again. And one of the things I've been working on, of course, is that in the UK, out of your local city, if you like, there's probably 50, 60 vets all vying for the business of treating your pets. And I would have said around about 10 to 15% of those will have their laser therapy hat on. That means the vets have been trained. They have to be trained to provide laser therapy. Even vets, hugely qualified people, very bright, but very focused on surgery and drugs. This is their mainstay of business, of course. And yes, they have the diagnostic tools, but sometimes you have to stand back and realize that not everything is cured by a drug, and not everything is cured by the knife. And the first statement that people in the medical world say when they swear allegiance is first, do no harm, and the second thing is don't make it any worse. Why am I saying this? Because I think that you would expect that everybody, like vets and doctors, would say, well, what are the options open to me to treat this patient? And yeah, well, we can cut it out, we can clean it up, scratch it off and debribe it, they call it, get rid of the rubbish and then sew it up, stick them on antibiotics. You know, you've got a swelling and inflammation. My God, it's been like that for weeks. And what do we do? What do we do? And we'll cut a knife, we'll have a look, we'll do an investigation. And then they can't find anything wrong inside the swelling and they stitch it back again and you're no further forward, quite frankly. But you should first look at all the available treatments available. Yes. Creams, no. Lotions, no, don't work. Drugs, well, not really. Side effects and all that. Tried them, didn't work. Okay. Right, it's down to the knife then. It's got to be the knife. Whoa, 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 hang on, tiger. There's one that's been around for thousands of years. It's called light. So, I want to do a video about this because I think that people should know about it. And if you see, you can't ask your local vet unless you know about it and you know what to ask for. And I would recommend that if your veterinary surgeons aren't availing themselves now, in this day and age, to photobiomodulation, that's what it's called, the PBM, photobiomodulation, they're in the Stone Age. And the good news, here's the good news, they're actually talking about now and teaching vets and doctors all about photobiomodulation as though it's a new thing. Well, it's been suffocated, it's been suppressed, folks. It really has. People were dealing with this. The Russians were dealing with it in the 30s, for goodness sake. They knew the benefits of light therapy, particular wavelengths of light therapy. Not blasting it with a laser, making it smoke and explode. No. We're talking about, specific wavelengths that the body reacts best to. And it is those wavelengths that the sun shines on us. Sun shines on us as a complete spectrum of light. But in the sunlight, if you could split the whole thing up, not just with a prism, but looking at the whole frequency of light, much of light we can't see, there is two little waveforms there that really impress people and get our living cells really excited because they are what is known as the healing wavelengths. You could say the healing colours. Yeah. Some of the colours damage us if overexposed, like ultraviolet. That damages us, but it's very, very, very good at treating acne, believe it or not. Certain types of acne. And you can get ultraviolet laser and you can treat yourself with your acne if you've got a teenager at home, but it's certain specific types of acne. But what I want to talk about in this video isn't so much human acne and ultraviolet. I want to talk about something else. You have a book here, Laser Therapy in Veterinary Medicine, Photobiomodulation. This is a mean old book. Okay? And it is written by 3 very established veterinary surgeons. Okay, look at that little pug at the front with his goggles on to protect them from the laser light. You see here? And it can be treated on all sorts. Well, this book, which is hard going, shows you, and I'm just trying to find a picture, of some of the amazing results you can have from by using photobiomodulation. I'm just trying to find a book before and after. Bear with me. I know, going to have a cup of tea. I'll be back in a moment. Pets are very tolerant, as are humans, for treatment with photobiomodulation. And more and more has been found. Just trying to find this bloody picture. I wish I'd found it, bookmarked it for you. More and more has been found and discovered of late, and people are quite happy. You can have a look at this one here. Okay, this is an animal's bottom, but there is a big fistula, and you can see after treatment that it's down to that size. Okay, and eventually it heals very, very quickly. Perhaps a bad example to show you. Okay, no anaesthetic. So what does this do, this photobiomodulation? Well, it modulates. And how does it work? What does laser therapy or photobiomodulation actually do? Well, pull up a sandbag, sit yourself down and listen to this. It speeds up the healing process. There we are. Wouldn't you like to get over your cuts, abrasions, torn ligaments, tendons, nerve damage, cartilage damage? A lot quicker than you would normally suffer. It reduces the suffering time for us anyway, and it repairs. It helps the body to repair itself. And the way it does that, it actually stimulates, like tickling a trout in the stream. The light tickles the DNA of the body. At where the damage is, for example, there's blood flowing past to repair the damage. It's chugging along at its own rate, dropping off oxygen, taking away carbon dioxide and the other debris. And it'll do it at its own sweet time. Thanks very much. As we grow older, that time can take longer. Okay? And now, this is what technology is all about. Okay? This is a laser. But it generates a set wavelength and for a set period of time. So if I were to just turn it on, it beeps, and you can see on my hand, or maybe not, you can see a very faint dot, but on my hand it's bright red. Okay, and if I put the two dots, can you see them? Okay, there we are. See them? If I put them down on my skin, that's shining a laser light now through my hand, basically. It'll go down to about 3 inches at this set power. So if I've got a knackered knuckle, for example, I could just treat my knuckle by going round and round and really going around in a square centimetre above my knuckle for a set period of time, treatment time. And it is firstly, the red light I can see is just an aiming beam. The actual laser is invisible to my eye, but it's right going in there and it's doing the work. It's tickling those little DNA. And inside the DNA, there are things called mitochondria. And inside the mitochondria, that's the factory of the cell, if you like. Okay? There is a chemical called adenosine triphosphate, ATP. And that is responsible for processing oxygen, as well as another chemical called cytochrome C. Okay? And that cytochrome interacts with the ATP to create basically oxygen or energy. It gets from the oxygen, it gets the energy, and that speeds up the healing process, or certainly initiates the healing process. some healing processes get stuck in limbo, and tickling it or treating it, exposing it to laser light speeds it up. Now if you think this is a joke, this is my laser and it's on, it's not hurting me, okay, but I've got reasonably white skin. This is a card, a test card, can you see that? If I were to put this laser there, can you see it smoking? Okay, can you see that? Yeah, look at that. Well, it doesn't hurt me though, does it? Okay. Because all my bodily fluids and my white skin are absorbing the energy. Okay. Black. Yeah. But if I was treating a black person or dark-skinned person, obviously I'd use less power. But I can use high power on me because I'm a white honky. So patients of ethnic brethren would have a less of a power setting over a longer period of time. But I can give myself a good blast and get away with it. Okay, so that's that. Make no bones about these, and this isn't a sales pitch, I'm going to talk about photobiomodulation in a minute. You would be wise to use goggles, because if inadvertently I shot that in my eye, it would burn my retina. Okay, so photobiomodulation, PBM, laser light therapy. Okay, so just to prove a point, you see the damage that the laser's done on that black? Yes. So just as an example, so if you've got an animal, a pet, or a bit of livestock, maybe it could be a horse, don't instantly resort to getting the vet to give it a drug or an injection or a steroid. Because, you know, they all have their side effects. They're all very expensive. Consider photobiomodulation. Find a vet that has a laser available to treat your animal. And find a good one. There's plenty out there that are adopting this new technology. And animals are very, very, very responsive to photobiomodulation. So next time you need to go to the vet, see if you can find a vet that endorses photobiomodulation or actually does it themselves. Now there are people out there now called pet therapists, and they are rapidly building up. I've lost my bit of paper. They're rapidly building up now into quite an established thing. There is masses and masses of clinical evidence backing these up. Okay. What about fish? Well, you've got a fish, that's fine. If you've got a fish, you keep tropical fish. Hardly a thing you'd rush to the vet with. Maybe, but your fish might have on its skin fungus. It's called, oh God, what's it called? White spot. Well, that's down to basically a fungus. Well, shine a laser light through at your fish and zap that fungus, and you'll find that it'll cure the fish without killing the fish. Or you could use methylene blue, which you just, you know, this white blue drug that they put in the water. It turns the whole water of the aquarium blue. But you don't need that. Just shine a laser light at the fish. But okay, that's just an example. Fin rot is another one that you get on tropical fish particularly. Well, we know what that is. So all I'm saying in this particular video is think twice about just accepting the knife from your vets. Naturally, some things need the knife, you know, but for things like nerve damage, cartilage, sprains, ligaments, damage to ligaments, tendons. Pets get, well, their own version of sciatica. You know, they get all sorts of things that humans get as well, folks, humans as pets, particularly cats and dogs. You know, they're always on the go, aren't they? And cats get up to all sorts of mischief. They usually end up with musculoskeletal pain, possibly damage, but they also get bit because they get into fights and scratches and they get infected. Well, give it some antibiotics. No, don't give the cat antibiotics or the dog, thanks. We'll try photobiomodulation because it might be full of pus and you can clean it up by all means physically, but then, you see, antibacterial, antimicrobial without the drugs. It'll kill the bugs. So this is a brief video just to tell you about the beneficial effects of photobiomodulation. Okay. Most practitioners will charge you for a consultation and treatment in the region for a dog, say, for a session, between £25 and £35. There we are. And this is the Bible, laser therapy in veterinary medicine, photobiomodulation. Photobiomodulation covers all aspects of using photons to modulate the living cell. That means to tickle it, to encourage it to speed up and heal thyself. And that's what it does, because sometimes animals and humans, we get stuck in this inflammatory phase. It's always, it's like neuralgia. It's, don't touch my face, hypersensitive. It goes on. That hypersensitivity has a reason. It's stuck. The healing process needs a jump start. Not this particular laser. You might go to your vets and get another one, but this is portable. You just zap it. You find where the nerve root is. Acupuncture now is more and more, instead of using needles, they're using laser on the points, on the acupoints. Reflexologists are using these. This treats fibromyalgia. This new thing that's hitting everybody has come out the blue. Yes, it isn't psychosomatic, folks. If you get an ear infection, in it goes. Yeah. Ear infections, I could go on all night and I really don't want to, about extolling the virtues of this is the future. This is the future. Now you get pet therapists who don't want to use a laser because it's a bit powerful and a bit over the top for them, not for their line of work. Maybe they want to use infrared and near-red wavelengths. And that's a lot more gentle, but you can treat for a longer period of time maybe. Okay, and they're super safe to use. And I could recommend a couple of good companies that you can get yourself a laser and treat with a minimal education your own pet at home, getting the benefits of photobiomodulation. Usually lasers are for the clinicians, like the vets and the surgeons, but the therapy world in particular, out there in the field, there's nothing stopping you treating your own pet by buying your own laser. But the problem is educating yourself, and you need to be certificated. Okay, so you need to be a qualified laser therapist, which means sitting an exam on laser safety, laser technology, the science behind it, and it's quite in-depth science. So it's better to find someone who's already done it and use them. Okay, but the world is opening up now. We're shying away from drugs. We're going au natural where we can. And it's about time too. Remember this, photobiomodulation. It's the future. And if your vet isn't offering it you, they're really being quite delinquent in their overview of the future. Because when you get guys of this quality writing in a book about 120 quid of all sorts from start to finish, go and buy this book if you really want convincing. Yes, there's probably some science in there you might struggle with if you're not science, but I tell you what, all these people can't be wrong. Do you and your pets a favour. Find a vet who does photobiomodulation, and I think that you'll be absolutely delighted. Your pets will heal quicker, less trauma, and they won't be traumatized by the surgery, and spare the knife and spoil the animal. Use photobiomodulation. Catch you later, folks.